The Leos ECP procedure differentiates itself from other MIGS in both the mechanism and also in the technique. Starting with the mechanism, most of our MIGS are outflow MIGS, and most of them involve the trabecular meshwork. In some patients, it may be that the TM is what's causing high pressure, and in others it may not. And that can lead to some frustration. With ECP, you're treating the production of ciliary body at the ciliary process, and that is a different mechanism entirely. It's an inflow production of aqueous treatment. So this is a procedure that can help any stage of glaucoma, and it really doesn't matter what the cause is. You're going to reduce the amount of aqueous humor being produced. Additionally, the techniques are very different. With angle procedures or traditional MIGS, you're using a gonioscopic lens, and that can be frustrating for some surgeons, and frankly, some surgeons haven't adopted those techniques. I do believe the visualization with Leos ECP is more intuitive, and you are just directly visualizing. You have the handpiece, you control what you're looking at, you control the quality of the view, and I think that learning curve, as well as the overall facility of the procedure, is favorable. One of the best things about Leos ECP is its versatility and how it can fit into many different areas or stages or situations for glaucoma patients. So I think it can treat glaucoma across the spectrum. Leos ECP can treat glaucoma across the spectrum of disease, from mild disease all the way up to severe. It does not preclude any other procedures being performed after it, so it's not as if once you treat the ciliary processes, you can't do other procedures. And it can even be done basically as the final procedure for some patients after they have scarring or other implants in their conjunctiva and after they've had trabecular meshwork procedures. So it can be complementary to other procedures, and it can also precede or follow any other procedure, and that's quite unique. One of the nice things about the new visualization system with Leos ECP is that it allows a phenomenal level of precision and certainty when you're giving an ECP treatment. So I can visualize the target tissue, namely the ciliary processes, better with the new version, the Leos ECP. I've really enjoyed the visualization, and it gives you a better ability to treat, to make sure you've treated everything you want to treat, and also to be precise in that treatment, meaning you're going to avoid hitting any parts of the eye, namely usually the underside of the iris, that you don't want to treat. Because of this, I've seen less inflammation and better pressure reductions, and it's been very impressive in terms of how well it's worked. Inflammation after a procedure, a laser procedure to the ciliary processes, is something that, in my opinion, can be handled quite well with preparation and with attention. What do I mean by that? Well, one of the things I've learned about inflammation over the years is that treating it aggressively up front is the way to go. So I believe that if you treat with an anti-inflammatory medication, namely I use subconjunctival dexamethasone, at the time of the surgery, you already are ahead of the inflammation, and you'll need less steroid and less anti-inflammatory therapy as a follow-up. So I think the inflammation with ECP is something that can be addressed, and if addressed properly, it can lead to excellent outcomes without having to have a fear that the inflammation is going to cause problems. The Leos ECP unit has been re-engineered entirely, and it's more intuitive, and it allows a lot of new efficiencies for performing the procedure. The setup is simplified. We have a single-use disposable ECP handpiece that is always in excellent working order, so you don't need to worry about things like cleaning the endoscope tip and things like that. What I really like is that we have now 3 different consoles that can control various aspects of the laser. We have a large screen that the surgeon sees that also has control options on it. We have a secondary screen that a scrub technician, either one who is scrubbed in or someone who is in a non-sterile environment, can adjust parameters, aiming beam, power, things like that. And we have a foot pedal now that allows me to adjust the angle of rotation as well as perform the laser itself. So it allows for a lot of variability or different scenarios where you and your staff can get this laser performed in a very efficient manner. It allows for a lot of different options for you and your staff to get the laser performed in a very efficient manner. With the new Leos ECP unit, the endoscope really allows for an excellent and consistent view. It has a auto illumination and some image processing that allows for the light to be interpreted and presented back to you in the best possible way. So I've found that I'm able to get really crisp, beautiful images of whatever I need to treat. So, you're taking the variability of having trouble visualizing things out of the equation. One comment I'll make, and this goes for any type of laser procedure, including SLT, is that really the only thing that's going to interfere with the success is the visualization. Anytime I've seen a case where a colleague presents a MIGS complication, there's never a great view. So having inadequate visualization is really a foundation to having an excellent result. And I feel like that has been addressed in the best way possible with the Leos ECP unit. One of the nice things about the way the laser integrates into the operating room environment, particularly with cataract surgery, is that the laser can be controlled now by a scrub tech who is scrubbed in and is sterile. So you have a drape that can go over the console, and they can control various settings, get the laser set up and ready to go for the surgeon. So that saves a lot of time. It cuts down on the number of people you need in the room. And I would say overall, the flow that can be achieved with this laser is excellent. I think one of the exciting aspects of having the new Leos ECP unit with the endoscopic visualization available will be that surgeons will recognize how useful it can be to take a look inside the eye for other uses other than applying the laser. For example, cataract surgeries can often have a dilemma over whether the haptic is in the best place in the eye. And of course, it can be very difficult to know for sure. And in the middle of a surgery, we may not want to take the extra time, knowing we may not be able to see what we need to see. This endoscopic view can really help you understand what pathology is there. It can help you whether you are looking at lens position, investigating some part of the peripheral sulcus, looking at where an implant is. For example, with tube shunt placement, you can't always see where the tube comes in. Well, now you can. And so a couple of comments I'll make is that while performing ECP over the years, I've realized that a lot of surgeons who sent me a patient had something with their cataract surgery that they may not have noticed at the time of the surgery that I'm now seeing because I'm in the eye. And so I do take a moment when I'm using the laser to look around at other parts of the anatomy, check my haptics and things like that. And I think for complex cases, this is going to be really helpful for making sure the surgeon has a confidence that everything is just how it should be.